Good morning and good afternoon for colleagues out in Africa. You're welcome to the webinar series, the Alliance for African Partnership Public Dialogue Series. This particular dialogue is on One Health and public health in Africa. It's co-hosted by University of Pretoria, and media partner is University World News. One Health recognizes the health of humans, domestic and wild animals, plants, and wider environment, including ecosystems that are closely linked and interdependent. The One Health concept has now developed from what we used to know as just a concept to an approach aiming at common public health goals. And One Health has taken renewed importance, particularly with the COVID-19 pandemic, further demonstrating the need to fast-track the operationalization of One Health. Today, this panel brings together diverse voices from front lines addressing One Health, implementation, and for strengthening public health and food systems reliance in Global South context. The next slide. I'm just going to talk to some housekeeping rules. We will have one panelist presenting in French. Please choose your preferred language in the interpretation that you prefer to hear in English or French, interpreted uninterrupted. You keep it off on the mute if you do not want the original language. If you are using a phone or tablet, select your preferred channel, then tap done. Please use the question and answer feature to ask panelists questions that will be addressed at the end of the dialogue. A recording of this dialogue will be shared with attendees. So I'll be joined today by co-moderator from the University of Pretoria, Professor Wanda Makota. She's a professor and director for the Center for Viral Zoonosis and the DST NRF South African Research Chair in Animal Infectious Diseases at the University of Pretoria. And before I hand over to the first speaker, I'm a professor of public health and the chair of the School of Health Systems and Public Health at the University of Pretoria. So I would now introduce the first speaker to give us an opening welcome. He is a distinguished professor of epidemiology and director of comprehensive epidemiology at Michigan State University. I invite John Canane to give us an opening remark. John, over to you.
Do I have the first slide, please? Yeah, thank you so much. You can see my big smile. I'm really excited about this day, and I'm looking forward to a very, very wonderful symposium on this very important point. Next slide, please. So this panel is composed of really distinguished individuals, and I like to provide my sincere thanks to MSU and University of Pretoria and all other funding or coordinating entities. I think this is wonderful. Now, we normally look at, when we are looking at One Health, commonly we identify major things: health of humans, domestic and wildlife, ecosystems, and I might add food and water security. Most books or conferences that you look at, that's how they describe One Health. Next slide, please. However, from an epidemiological standpoint, I will I will argue that the full understanding of the complexity of One Health implementation, policies, and strategies for disease prevention and control will need to involve more than the traditional biomedical disciplines. Everybody has to be at the table, and we cannot look at the problem we have had like Ebola and so on, and how many disciplines actually have contributed to our control of these diseases. Next slide, please. So disciplines from social sciences and humanities, such as communication, sociology, social work, economics, anthropology, and to mention and others too that I didn't mention here, need to be part of the team. And given the wide diversity of ecosystems, healthcare and resources on the continent, this dialogue is extremely important to see how we can massage all these differences in ecosystems and resources available on the continent. And of course, when I say the continent, I mean the African continent. So I'm really looking forward to having this dialogue. I'm here to listen and learn. Next slide. Without taking too much time, I would like to thank the coordinators of this program. And like I said, I'm smiling ear to ear and looking forward to this wonderful day. Thank you.
Thank you, John. I'm handing over to my colleague, Wanda, to take us through the next session featuring our 4 panelists. Thank you.
Thank you, Prof. Lakan. And welcome to everybody, and good morning, good afternoon, and good evening to everybody from all over the world. It's really an exciting event to be part of. And we're going to start with the first speaker, who is Wayne Ramkrishna, who is the Deputy Director of Zoonotic Diseases in the National Department of Health in South Africa. And he's going to share some of the experiences in South Africa on One Health, but also the challenges and maybe future perspectives. So thank you, Wayne, and it's really great to have you as part of the panel. You can go ahead.
Thank you, Prof. Good day, colleagues. I would like to talk briefly on the implementation of the One Health approach in South Africa. Next slide, please, Justin. The World Bank report of 2018 highlighted the burden of zoonotic diseases as over 1 billion cases and 1 million deaths annually, with considerable economic costs. Zoonotic disease comprise of more than 60% of known human infectious pathogens, and also include aspects of vector-borne diseases, food and water safety and security, and antimicrobial resistance. Zoonosis and other health threats at the human-animal ecosystem interface pose ongoing and increasing risk to public health. And African countries face a disproportionate level of this risks. Communicable diseases outbreaks are likely to increase with changes in land use, agricultural practices, climate and weather, travel and trade, and urbanization. WHO member states, including South Africa, have obligations in terms of the international health regulations for having systems in place for identifying and assessing potential public health threats, including zoonosis. However, these threats cannot be addressed by one sector alone. Therefore, public health systems must be resilient and prepared to face existing and future zoonotic disease threats and implement interventions at the human-animal environment interface in an integrated manner. We should all strive to implement One Health approach in our various work projects or activities. The complexity of interactions along the animal-human ecosystem interface requires strong and consistent collaboration among the sectors. Next slide, please, Justin. Recognizing this fact, the Department of Health in South Africa facilitated the establishment of the One Health Forum in 2015, which includes members from the National Institute for Communicable Diseases, the Department of Agriculture, Land Reform and Rural Development, the Department of Environment, Forestry and Fisheries, the universities, and all provinces in the country. The goal of the One Health Forum is to strengthen collaboration and coordination between public health, animal health, and environmental sectors for prevention and control of zoonotic diseases, as well as to meet the international health regulations obligations. A One Health steering committee was also established, comprising of members from the One Health Forum, and these members serve to guide the activities of the One Health Forum. The One Health Steering Committee and the One Health Forum are co-chaired by the National Institute of Communicable Diseases and the Undertaken Veterinary Institute, while the National Department of Health serves as the Secretariat. Now, South Africa is in the process of drafting a national framework for implementation of the One Health approach. This is aligned with the much anticipated global One Health strategy, which when complete would guide activities of stakeholders involved in One Health. This will entail not only shared responsibility among the stakeholders, but shared benefits as well. There are several One Health initiatives. Next slide, please, Justin. There are several One Health initiatives ongoing in South Africa, and these include outbreak response. We have multi-sectoral responses to conditions or diseases such as rabies, avian influenza, and of course, COVID-19 as well. The One Health approach was used in development of several guidelines and information, education, and communication material, including the framework for the implementation of One Health in South Africa, the rabies elimination strategy, the NTD strategy, the prioritization of zoonotic diseases in South Africa, the exercise that was conducted, as well as several rabies, anthrax guidelines, pamphlets, posters, and so on. In terms of research, there is ongoing work on brucellosis, viral hemorrhagic fever, and so on. In terms of communication, we have collaborations on drafting One Health newsletters, press releases. We collaborate in celebrating One Health days and rabies days and so on. We also have several One Health committees, including the One Health Forum, the One Health Steering Committee, the Rabies Advisory Group, the Brucellosis Steering Committee, as well as the Neglected Tropical Diseases Technical Working Group and the Vector-Borne Diseases Technical Working Group, just to name a few. As I mentioned earlier, next slide, please, Justin. As I mentioned earlier, South Africa is in the process of drafting the framework for implementation of the One Health approach in South Africa. This is the framework through which work plans, budget allocations, and monitoring plans will be developed. The framework was developed through a series of stakeholder consultations and discussions. Based on these discussions and a SWOT analysis that was conducted, the following challenges for the 4 key working areas were identified, which the work plans must address. But these challenges include coordination of stakeholders. We need to strengthen coordination through formalization of functions and extension of the One Health approach to other relevant stakeholders and sectors as well. In terms of epidemic preparedness and response, there is inadequate multi-sectoral collaboration. There is this needs to be strengthened through agreed upon work plans across sectors and stakeholders, including projects and activities, etc. We need to prioritize integrated disease surveillance and timely information sharing. And this would go a long way to improving or strengthening our early warning systems for outbreak response. In terms of research, Although there is a lot of research that's going on using the multi-sectoral approach, there is still a lack of a national research agenda to enable relevant research to guide policy development and implementation. We need to facilitate research group discussions to agree on research priorities. We need to agree on areas of collaboration, funding mechanisms, and so on. In terms of communication, we do not have a formalized multi-sectoral information sharing platform, although a lot of communication goes on among the stakeholders. We do not have a formalized platform. So improved stakeholder communication is required at all levels, including the community level. We need to prioritize risk communication as well. Next slide, please, Justin. We have learned several lessons from the COVID-19 response, and these include coordination, that is capacity to identify and coordinate a wide range of stakeholders, including government departments, private sector, public sector, donors, etc. Now, during the COVID-19 pandemic response, we have had several newcomers who have provided support to the department, and coordinating the activities of all the stakeholders were proving to be a challenge. So in future, we need to prepare ourselves and be better prepared to coordinate multiple stakeholders. We need flexibility as well. We must be able to adapt to evolving situations. Example, sharing of capacity and expertise among sectors. For example, sharing expertise from the Department of Health and the Department of Agriculture in terms of laboratory capacity, expertise such as epidemiologists and so on. We must be able to ramp up production or procurement of supplies such as PPE, lab test kits, and consumables. We've seen these as challenges during the COVID-19 pandemic. We need agile supply chains as well. The use of technology was highlighted as an area that needs to be really enhanced, and it's proven its work during the pandemic when it was used for contact tracing and so on. But I think we can expand electronic technology to for areas such as the use in integrated disease surveillance. And we also need to look at maybe explore artificial intelligence systems for improving our surveillance systems. In terms of preparedness, we need to develop and maintain capacity to respond to large-scale outbreaks or pandemics with trained personnel, with updated guidelines, SOPs, and so on. We must have the ability to mobilize urgent resources and capacity. The H1N1 pandemic in 2009 was quite a mild pandemic compared to the current COVID-19 pandemic. So we must be able to adapt very quickly in such circumstances. Quality assurance and quality control has proven to be quite an important area as well. During the pandemic, we received much equipment, including PPEs, but many of them were substandard. So we must ensure that we have good quality products, for example, PPEs, equipment, lab test kits, and other supplies. In terms of the international health regulations, we need all stakeholders actively participating. There is need for strengthened stakeholder coordination, risk assessments, desktop reviews, simulations, etc. And I think we should be looking at this very seriously before the next pandemic. Next slide, please, Justin. So colleagues, in conclusion, much work has been done in implementing the One Health approach in South Africa, but much more lies ahead. Thank you.
Thanks so much, Wayne, for all those insights. We're going to leave any questions or comments for the question and answer session. So please use the chat and write that, or not the chat, the question and answer button to send us some questions for Wayne that we will answer afterwards. But then we're going to move on to the next speaker. Can I have the next slide yet? Thank you. Who's Dr. Yewande Alimi from African CDC. She's actually an antimicrobial resistant and One Health program coordinator. And she's going to share with us some of the experiences and the way forward with African CDC, specifically looking at multi-sectoral collaborations and mobilizing resources in the Afro region. So we're looking forward to your talk, Doctor. You can go ahead.
Thank you very much, and good afternoon, morning, or evening to participants. Just to showcase what is going on the continent and leverage of what the previous speaker said. Africa CDC is a technical institution of the African Union, whereby our focus is really around public health and improving the health outcomes of the continent. But one of the unique approaches that the Africa CDC has taken is in terms of advancing One Health in Africa. Leveraging on our political mandate of the African Union, our role is really to convene, to lead the coordination, the collaboration, and ensure that we have effective communication across various stakeholders. Next slide. So ideally, of course, as we started our work, one of the key things that our group did was trying to understand where the gaps are in terms of institutionalizing or operationalizing One Health across our continent. So as early back as 2020, late 2020, we had a baseline needs assessment, which serves as an iterative process for the African Union in terms of addressing the gaps and the needs of our member states. Next slide, please. So a few things come out very clearly, and I'm glad the previous speaker really highlighted some of these things. One of the gaps that comes out very clearly is around multi-sectorial One Health coordination mechanisms. Across the 29 member states that responded to this survey, you'd see that quite a number affirmed to having a multi-sectorial coordination group, while others were in the process of developing. Upon our desk review, of course, we found that across our 55 member states, only about 17 had formalized or institutionalized a multi-sectorial working mechanisms. Next slide. Addressing issues around surveillance as well as coordinated surveillance and data sharing, we looked at the gaps in the NPHIs, which are the National Public Health Institute or the Ministries of Health, and trying to understand where the gaps are around data sharing. You would, if you look very closely, you see that more than half of our countries indicated that there were no existing data sharing policies across NPHI's Ministries of Health, as well as Ministries of Agriculture or the Veterinary Public Health Institutes. Next slide. In terms of the capacity around emergency response, preparedness capacity, we try to understand how many countries had undergone the joint risk assessment and having an operational joint preparedness and response plan in place. Of course, we're starting to see good progress across our member states in terms of the emergency operations center having a One Health staff in place. But of course, there remains a very large gap around stockpiling for things like vaccine, as well as PPE when it comes to priority zoonotic diseases. Next slide. The next slide is really, I think, this is really priority for the continent in terms of what the workforce looks like in terms of One Health. For example, many countries have started to operationalize what we call the FETIP programs, but many of them are still lacking the One Health component. Means that the workforce is primarily focused on public health issues only, and we don't have sufficient workforce to address issues around priority zoonotic diseases. Next slide. So to address some of these gaps, Africa CDC has launched a framework called the One Health Framework, which is a technical guidance document for Ministries of Health as well as National Public Health Institutes to operationalize and address some of these gaps that we have identified in our baseline needs assessment. Our target at Africa CDC is really to address issues around One Health coordination, looking at multi-sectoral coordination mechanisms, setting up and institutionalizing prevention and control programs for priority zoonotic diseases such as rabies, zoonotic flu, and as well as the viral hemorrhagic fevers, which are our continent usually has pockets and clusters of outbreaks. One thing that has been missing on the continent is the need and understanding what the One Health research agenda, as well as an operational research agenda, should be for our continent. Our role as Africa CDC really focuses on supporting countries with coordinated surveillance, improving diagnostic capacity, as well as linking laboratory networks, not just across human health, but across animal and environmental health sectors. Having a stronger, more improved coordinated response system that really reflects a One Health approach and really reflects a multi-sectorial workforce. Just showcasing a few things that we have been doing in terms of resource mobilization, not just financial resource, but also looking at technical resources across our continent. The next few slides will showcase some of the things that we have been supporting the 55 AU member states on. Next slide, please. So first of all, as a start, going back to our role as a political institution, a technical institution embedded in a political institution. We have the convening power. As such, we have been working with our several technical partners, such as the tripartite on the tripartite zoonotic disease guide, as well as other technical and funding agencies. Our role is really to ensure that no country is left behind and no sector is left behind. As such, we ensure that resources are shared across our countries as well as across sectors to ensure that at least the human health sectors and agricultural sectors, as well as the environmental health and plant health, can easily adopt global standards to improve One Health practices across our countries. Next slide. So just showcasing some of the other things that we have done. We have been working as well with the regional economic communities of the African Union, which really play a crucial role in advocating for domestic financing and local resources to support countries. We recently developed a database of One Health experts pooled across from our member states as well as our regional economic communities. As you can see from the map, we still have gaps. There are countries that are reporting that they do not have any One Health expertise. So our role as Africa CDC is to ensure that all of our 55 member states have the expertise required. And as such, we have been several training activities as well as workshops. In order to ensure that all of the funding and financing coming to Africa is well spread, is properly spread across countries, regions, and sectors, we have been coordinating with our regional collaborating centers of Africa CDC and ensuring that we work very closely with technical partners as well as our development partners. Next slide. Some of our technical partners, such as WHO, FAO, OIE, as well as US CDC, ECDC, and Public Health England, have developed unique operational tools that can advance One Health on our continent. So as leveraging on our convening power, we have been supporting our member states to ensure that we're able to upscale the One Health capacity through regional strategy planning, like we do for EAC as well as ECOWAS region. Supporting our member states with workshops and rolling out operational tools such as the joint risk assessment, the MCMs tool, improving surveillance and information systems, conducting zoonotic disease prioritization, and of course, improving event-based surveillance using a One Health approach. Next slide, please. So finally, I think our role as Africa Union is really to ensure that we are able to effectively coordinate and collaborate. But most importantly, how do we ensure that the information around One Health and the progress our member states are making, we are able to effectively communicate it. Thank you.
Thank you for that presentation, Dr. Yewande, and the great work that Africa CDC has been doing on One Health and also with the COVID pandemic. So we're going to go to the next speaker. Next slide. Professor John David Kabasa, who is the principal of the College of Veterinary Medicine and Animal Resources and Biosecurity at Makerere University, and also the co-PI of the African One Health University Network. So welcome, Prof. John, and we're really looking forward to your talk. We're really going to share your experiences on One Health in relation to health and food systems. That's also really important in the One Health concept. Thank you.
Good morning, good afternoon, everyone. I'll go to the next slide. Thank you so much. I have a few talking points to discuss what we could consider in handling an effective framework monitoring and evaluation for One Health within the context of health and food systems strengthening. I've taken the liberty to synthesize a few thoughts and present to this distinguished panel, and I would like to appreciate the opportunity to share. Next slide. When looking at the building blocks for an effective monitoring, evaluation, and learning system for One Health, there are a few things that one may want to look at critically. The first one is the default logic that brings about One Health. First of all, we are aware of the definition of health, that it's not merely absence of disease, but the entire well-being of the individual. So by the definition already that we do have, which was pitched well before, the element of One Health was embedded. So in a way, the discussion or the discourse of One Health today recognizes some of the irregularities in the practice of health and the practice of public health as we have evolved over time. One Health is systemic in nature. And therefore, in designing interventions for One Health, we should by default have been taking a programmatic approach rather than projectization. But over the last century, much of the health approaches have been projectization. If we are expecting to see One Health, which is holistic, addressing the various pillars as the previous speaker have articulated, we should be then saying, if this intervention X is being made, how will it impact the human, the animal, the plant, the environment, from a systemic approach right from the very beginning? We needed to be intentional. We needed to be deliberate in our interventions to health. If we are then deliberate, this means then that the theory of change towards the products that we are advancing over these target groups in the ecosystem, whether plants, animals, humans, and so on, should be defined in every intervention. Short of that, our interventions are targeting the human only, and we will get what we always got. The design of the monitoring and evaluation system should then accordingly have those elements. If you design for the human, you design for the animal, you design for the plant, you design for the ecosystem. So the outcome is a systemic outcome. The benchmarks and the indicators should therefore be comprehensive. But what have we seen over the time, even the most recent interventions. Interventions have demonstrated the principle, but a true One Health is yet to be realized. Next slide. Next slide. Thank you. When designing a One Health monitoring and evaluation system, that takes into consideration the aspects that have been highlighted, including food systems. We should be willing to be learning all the time. We are dealing with the complexity, and we expect a lot of knowledge to be generated throughout the time. An action learning approach, action research approach is integral to the entire process of monitoring and evaluation when dealing with the One Health systems and designing these systems to give the expected outcomes. A learning agenda is therefore integral, and if a learning agenda is integral, the data management should be integral. How the data be captured, how will it flow from the local community, the subnational, the national, and if it's a regional or global framework or initiative, these aspects should be properly designed from a systemic approach. This gives the opportunity for the One Health approach to regenerate and continuously improve so that we are able to see what actually the objective of One Health is all about. Next slide. For us to appropriate the current intervention logic, the systems approach, the programmatic approach, the human capital that we have to execute has to be reoriented. The setting of the mindsets of the current executors, planners, policymakers, and so on needs to be realigned. And this begins right away at the level of leadership. We need to retool both in soft and hard skills the various levels of execution of this kind of learning system. And therefore, One Health monitoring, evaluation, and learning system should have capacity building programs integral if we are going to appreciate and to see what we expect to see from the perspective of integration of public health dimensions of One Health and food systems. An approach that is programmatic in nature requires a proper command. And this then brings up the notion of systemic interventions having a proper coordination mechanism. The issue of who commands, who coordinates, who communicates, who controls, who regulates and oversees the commitment during the entire implementation of the intervention and the collating of information and data so that this can be integrated to give a system that will give us the right information that speaks to the system rather than speaking to a silo that is targeting a specific population in the ecosystem. So coordination mechanisms with proper structures, processes and guidelines will ensure that the substance that we expect out of the process, which is the One Health, interconnected health, is actually achievable. Without appropriate mechanisms of this nature, we are likely to gravitate into the traditional approach to health systems. The other thought that we would like to share is that all this has to go along the resource allocation, but resource allocation which is disciplinary or driven along disciplinary leaderships will not help us realize the One Health, the interconnected health that we are talking about, and therefore a monitoring and evaluation system that hopes to enable us to realize One Health goes along with the appropriate resource allocation. So imbalances in the distribution of resources, in the allocation of resources for any interventions should ensure that dimensions of human, animal, plant, environment, and the wider ecosystem are actually integrated in the design. Next slide. In summary, we can highlight some of these things from our conversation, the talking points that highlight why some of the initiatives in One Health have gone unmonitored. That while we are talking about One Health, most likely the intervention logic remained under the drive of the conventional disciplinary interventions. Secondly, lack of clarity on the target populations during the interventions. That once we set as One Health, then there should be a change that we expect to see in the human, in the animal, in the plant, in the wider environment, so that we are able to measure how these became interconnected and how they led to specific outcomes in the short term, in the medium, and in the long term. Clarity of the needs of these specific intervention groups, the target populations, will be critical. If this is faulty from the very beginning in the design, then the theory of change becomes faulty. And if the theory of change is faulty, the expected outcome, which is the product being packaged by the people driving the intervention, becomes inappropriate for this population. And therefore the ML plan also becomes unclear or faulty, and the benchmarks and the indicators become inappropriate, and the resources, therefore, in a cascade of being inappropriate, and this is aggravated by a projectized approach to One Health. As long as we have projectization of most of this is enhancement of fragmentation, there is need to reflect a little bit more when we are intervening from a One Health approach. The question of a programmatic approach, so that we are able to realize the outcomes and their interconnection at the system level. And therefore, we will then talk of a One Health system monitoring and evaluation system, rather than simply a project monitoring and evaluation system. These were the thoughts I wanted to share with you. And I speak on behalf of the One Health Academy, as well as the colleagues that we have had from Makerere University and many other partners that have shared in these few thoughts for our discourse. Thank you very much.
Thank you, Prof. Kabasa, for those insightful comments that you've shared and your views. Please remember to send some questions in the Q&A that we will handle in the question session. So we're going to go to our last speaker. Next slide, please. Who's Dr. Fatimata Niang Diop. I hope I pronounced that correctly, Doctor. She's the Deputy Director of Zoonotic Diseases at the National... No, now we're on the wrong one. You've now got Wayne there with her picture. Okay, there we are. She's with the university in Dakar, Senegal. And you saw her picture on the previous slide, but that wasn't her name, but at least you know how she looks. And please remember, there's going to be French interpretation. The speaker is going to present in French. So there's the interpretation button at the bottom of the slides that you can just switch to English if you wish to have interpretation. So thank you, Doctor. We're looking forward to your thoughts on how higher education has implemented some One Health research approaches. Thank you.
Bonjour ou bonsoir.
Good morning or good afternoon, depending on where you are. It is a real honor for us, for me, to share with you this communication, which is on the implementation of the One Health approach in Africa, and what are the measures that the higher education could take to have a better impact on the health system in the region. So there I'm going to start with a slide, with the next slide. Next slide. So I'm going to start with the second slide, please. Second slide, please. So, okay, so I'm going to start by reminding concerning the lifespan increase in Africa, which from 1950, the 1950s, which stands from increase from 25%, depending on from the United Nations, and we have also enhanced also the quality for the tools of prevention and diagnosis, but also the treatment that have enabled to expand lifespan. But despite all these efforts, there are we have this, as you can see on the map, in different African countries, there are still many things to do in terms of health. And that's why Africa, where lifespan is the lowest, despite that increase, compared to the rest of the world, it is still low. But there are still impacts like the COVID-19, the wars, political instability, poor governance, and also climate change and environmental change, which have really the root of this stepping back of the in terms of health. So next slide, please. So in front of these daunting challenges that really curb the progress in terms of health, we have the intervention of multiple actors, and especially actions that are diversified everywhere through the organizations, intergovernmental organizations like ECOWAS, or even the helping development agencies like USAID or AFRO. And this presentation will also put the focus on the achievements that have been made in terms of the afternoon. We have in Africa many actions, many programs that have been implemented, especially PPT1 and EPT2. But recently, we can quote the Center One Health Africa, which was launched in 2020 by so as to make easy networking, knowledge transfer, also in-depth knowledge, and also applicable and sustainable research in the African region. Concerning the next slide, please. So for you can see from AfroHoon, we can notice a starting point of operations of One Health in African context. There are different modules that have been developed, and many students and teachers and even professionals of the health have benefited from these trainings. And so up to date, 1,432 teachers were trained, and there also One Health in the curriculum, in the science of public health, in medicine, veterinary medicine, And also in environmental science, we have to say that environment was really the most important, let's say the weakest, the weakest part, meaning the lame duck in this environment, was the lame duck of this program, of this approach, One Health approach. Today, we can have hope with the programs that are implemented in the framework of AfroHoon in our university. We especially the program of the master program in Senegal. We have a master's program on a multidisciplinary program where will bring along environmentalists, doctors, specialists of health practitioners. Especially at the university too, there is an identification of needs and also offers of training in different fields related to One Health. And so far, we can say 4,555 students were trained in the field of leadership, gender, communication, on and also and we have also made demonstration sites for all our people who are member of AfroHoon. Next slide, please. And just to insist on the training for students in our universities through the scholarship of training and also fellowship, and we have grants for research. We have a group of young researchers who are trained in different universities who are members of the AfroHoon network, and this has enabled to have at least multidisciplinary research teams that are working especially, and that are cross-cutting disciplines. They work on environment, public medicine, and also veterinary medicine. Young researchers who are now working together in an interdisciplinary way, and I think this is a very good start in the term of the One Health approach in our university. And at the same time, you have activities, competition activities that One Health organized without also overlooking awareness raising, communicating, outreach with local communities so as to better raise awareness on the issues of One Health. And lastly, we can go to the creation and extension of One Health in all the different countries, different universities who are member of the AfroHoon network. We have put in place clubs for students, and in Senegal from 2016, and now we have at least 4 clubs or 5 clubs that have been set up at the universities, Senegalese universities, but the situation is still the same in other universities in different countries who are members of the AfroHoon network. Next slide, please. So despite these efforts that have been still at the budding stage, we can see that operationalization is ongoing, but nonetheless, we are still encountering some challenges. Those challenges are we have some challenges by when we talk about in a comprehensive approach of health. So universities should really tackle this issue in an intersectoral way. And the COVID pandemic also highlights the importance of some scientific field, which was a kind of overlooked, and we show that the biodiversity and infectious disease, how they're important. And the collaboration of between countries is also a very big challenge, but also the funding of research will also help. Lastly, we have also noticed some weaknesses in the operational research initiatives, but also in the data concerning data and evidences so as to make informed decisions. Even when they inform those data exist, we need to have their sharing between different stakeholders also is really very challenging. Access and sharing are really the biggest challenge, are another challenge. Next slide. Next. So to conclude, we make this recommendations. Higher education, African higher education should adapt its training offer and evolution should evolve in some socio-economic climate, and also initiate the future researchers to the multidisciplinary approach and transdisciplinary approach. And only this regional approach will enable us to share resources and knowledges between different countries. And there is a need to create more research centers, regional centers related to cross-border issues. Not only one country has all the necessary resources to develop the expertise in all the fields. Universities in the region should collaborate and pool their resources so as to develop centers, training centers that will share their knowledge for the benefit of all. We need also to support the scientific production and also outreach at the level of decision makers, and also African University Network of Afroon should also be an opportunity at the continent level to promote training and research on the One Health. That's what I wanted to share with you, and I thank you for your kind attention. The last slide is just for references. Thank you. Thanks so much for your kind attention.
Thank you, Dr. Fatimata, and thank you for sharing those wonderful initiatives with higher education students. It's really encouraging to see the training and the collaboration that happened. Thank you. So I guess we're going over to questions, and I see there's quite a lot of questions, so I'll start going through them, and please add more. If you think of something, I will address them. I will try and address them to one of the panelists, or I will ask whoever think it's in their expertise to address it. So the first question, I can't see who this was from, but it is, what is the current place or role of public health entrepreneurship under the One Health concept? And what initiatives and incentives are needed to stimulate public health innovation and capacity development in support of the next generation of public health professionals who will be charged with future or global pandemics? So if I look at the expertise on the panel, I wonder who I don't know if Africa CDC maybe can talk about entrepreneurship, or Prof. Kanine is maybe also somebody who can comment on that. Any of the panelists who want to address that question? It wasn't directed to somebody specific. The role of entrepreneurship. Anybody?
Sure, I think let's take a stab at it. I think maybe a way to look at it as opposed to zooming down into entrepreneurship is the private-public or private sector partnerships. COVID has been a classic example to show us how much resources we have on the continent and how we can achieve many more public health outcomes by opening up the space to private sectors, of course, to businesses who are interested in supporting the common good of the continent. So as opposed to zooming into entrepreneurship, I would say there's so much potential for us to work with private sector. I mean, for local manufacturing of PPE, for example, local manufacturing of drugs, as well as vaccines, which we are really advocating for on the continent. Over to you.
Thank you, yeah, and I think it's mentioning vaccines. We've had a lot of discussions during COVID how we need to establish expertise and capacity on the African continent, and that is also where this comes in. It's really needed past the pandemic also, that we develop our own expertise and our own capacity. Any other panelists that wanted to comment on this question? Otherwise, I'll go over to the next one. Let me just, so this is also not really, I think it was maybe directed to Wayne or the second speaker, but thank you for an excellent presentation by Joe Creeves. I'm wondering if the health sector in Africa are including non-health practitioners like economists, the statisticians, data scientists, and analysts who could also guide accurate health research and policy. And how can somebody as a young African get involved in this field if they are part of One Health? Anybody want to address that question from the panelists?
Prof, I can attempt to,
yes, right.
As just part of it. Yes, definitely a great question. And definitely there is a role for economists in developing health policy and programs and so on. Because as we know that much of our health systems depend on funding, and we want to derive the best from the limited resources that we have. And therefore, we need to spend that extra time doing cost-benefit analysis, for example, so that we can choose from the options that we have the best options at the lowest price, and that would save lives and prevent disease. Okay, so definitely there is a role for that. I can mention a few examples. Most recently, we have conducted a cost-benefit analysis for our influenza program. We have been conducting influenza vaccinations for over 10 years in South Africa, since the 2009 H1N1 pandemic, but we hadn't really looked at systematically what the exact cost and what the benefit that we would derive. And this was done with collaboration from WHO and the University of Witwatersrand. So funding came from WHO and the university assisted with conducting this the study. And we now have a study to look at what is our actual cost for this program. Thank you.
Thank you, Wayne. Anybody else that wanted to add to that from the panelist side? I think it's really important to understand that One Health is not just medical doctors and veterinarians. It's really a lot of other disciplines also. That's really what it is about, and it includes economists, social sciences. I see the next question is actually about social sciences, and it was after the first two speakers, Wayne and Yewande, where Debebe Era said, "Thank you for the excellent presentations of the two speakers. One Health partly requires changing human behavior for effectiveness of public health and environmental interventions. Would you please share us your experiences about the role that social scientists played during your studies?" So Wayne and Yewande, it can be directed to you, but any of the other panelists may also want to share some experiences around that.
I can go first, just to share some of our experiences very briefly. Using the COVID-19 pandemic as an example, I think we all know the challenges that we experienced with delivery of the vaccine or administration of vaccines and the uptake, more especially from the public. And I think the social scientists played a huge role in this, as we're able to actually sort of segment the different attitudes that people had towards the vaccines, and therefore we could actually segment our responses to these various groups. For example, some people felt that the vaccine was dangerous, so we had to have responses towards that category of the public. Some people felt that well, they couldn't have access to it because they live far away from the health facilities and so on. So we need to have a response to that and so on. So social sciences are important to go down and drill deep into and figure out what the root cause of the public behavior is. And therefore we can address them more specifically. Thank you.
Thank you, Wayne. Any thoughts from Yewande?
Yes, so in terms of engaging social scientists, I think it's really a crucial point that we have been missing as technical people as well as policy experts in terms of how do we actually drive behavior change and to have at least sustained interventions or sustainable interventions. I look at my experience in terms of antimicrobial resistance, which is something that we have been able to engage behavior change experts as well as social scientists. But we went a step further to engage civil society groups in terms of letting them lead the advocacy and behavior change by equipping them, building the workforce for civil society groups. And I mean, we started that work as far back as 2019, building what we call the antimicrobial resistance champions. And that worked very well in our favor because when COVID did hit the continent, those were the champions that were able to help us in terms of passing across the right scientific messages. So I think there's so much potential that we can, I mean, when it comes to zoonotic diseases and other One Health related issues for us to engage behavioral scientists, social scientists, as well as civil society groups and other champion groups.
Thank you for those comments, Dr. Prof. Kabasa.
Yes. The solutions to the challenges in the community are a consequence of molding knowledge and experiences from a diversity of people. And definitely from the social perspective, that knowledge is critical in molding the innovations that we need and in seeing how the innovations will fit in society. Many of the innovations that have been brought for interventions are rejected because of being half-baked or not being presented from a manner that integrates knowledge and experiences from diverse segments of society. In the very recent examples of COVID and so on, we needed a combination of all disciplines and all experiences to be able to mold a solution, right from the engagement of police, the engagement of the army, the engagement of social workers, the engagement of veterinarians and farmers, including cultural leaders at various levels. And this is a very clear example that social science and many others play a critical role in the molding of innovations and the processes that will give us the substance we hope to see. Thank you.
Thank you, Prof. Kabasa. Dr. Fatimata, I don't know if the interpretation is on, but maybe you can share.
Effectivement, moi, ce que je voulais rajouter par rapport...
Yes, in fact, what I would like to add on what the colleagues have just said is that currently scientists were confronted with the reluctancy of some health professionals. When we take the case of Senegal, there were researchers, lecturers who get closer to the communities, but in reality, there were difficulties. The challenge was how to collaborate with the health professionals, because up to now, for some of them, this has to be handled, or this health problem has to be handled by the professionals. So sociologists didn't have their place in all this. And we had a colleague who was confronted with a lot of difficulties, but finally he got results at the national level. What does it mean? It means that there is a collaborative work between sectors and disciplines that we need to strengthen, and between the scientists of the various disciplines in order to move forward. That's the comment I wanted to make on what my colleagues have said. Thank you.
Thanks so much, Dr. Fatimata. I think we talk a lot about response, but the social sciences also have a very large role to play if we go to prevention and if we really look at early warning systems and human behavior. So it's an integral part of One Health that I think has been neglected for quite a while. As Dr. Yawanda also said, you know, we sometimes forget how important the social sciences are in the whole picture on One Health. So the next question is again for Dr. Yewande, and it's really about policy. And it came from Joe Creeves, who said there was quite a small sample size that you presented, I think 29, to inform policy. But what he would like to know is, from the findings obtained from the study, what are the short, medium, and long-term goals and outcomes? If you can maybe answer that.
Thanks a lot for that question. Quite interesting. Yes, indeed, I agree that our findings can definitely inform policy as well as interventions. So one of the things that we've started to do, like I showcased in the presentation, is implementing the One Health framework for MPHIs. This framework really details all of the ways we can address, both as Africa CDC, as well as our member states, how to address some of these gaps. For example, one of the things that we have started supporting our technical partners, the tripartite, is the implementation of the multi-sectoral coordination mechanism tool. It's an operational tool. And if you want to learn more about it, if you just read on the tripartite zoonosis guide, there are several operational tools that will lead any country, any facility, any institute from a point A in terms of having no coordination mechanisms, having no one else in place, to where we envision or where we advocate that countries must be in terms of having formalized, financed multi-sectoral working groups. We're also supporting several countries with strengthening some of the laboratory capacities through our RISNet network, which is a regional laboratory support mechanism that we have put on in place across the regions on the continent. So in terms of our short-term goals, ideally is to help countries that have something in place in terms of informal multi-sectoral working groups, informal workforce, is to lead them and push them towards a more formalized mechanism whereby there is domestic financing, there is legislation or policies that can enable data sharing, improve surveillance systems, and things like addressing gaps around stockpiling. Beyond that, of course, our long-term goal is really to have all of our 55 member states have detailed findings around their priority zoonotic diseases, around having institutionalized workforce, One Health workforce, not only in their response systems, but in programs that can actually prevent and control. Beyond that, we envision that the continent must develop its own research agenda, because this is the only way we can actually finance some of these gaps. We need to really look into operational research as well as implementation research for One Health. So I think our goal is really, we are on the right path towards the goal where we're supporting our member states. We already, slide, I already showed some of the countries that we are supporting. Of course, our arms are open. It's just left for the countries to make that request, and we are able to facilitate the support and address some of those gaps identified. Over.
Thank you, Yewande. And maybe to follow up on that question, or on that answer, there's another question on if we have a list of priority activities or zoonotic diseases for Africa that we think we should focus on. I know South Africa went through an exercise where we created the list, but do we have a more broader Africa list?
That is really interesting. As a matter of fact, that is one area that we are keen to see. We think it's literally one of our short to medium term goals, whereby I think, first of all, I must say to all participants, I'm looking at it, giving a helicopter view of the continent. Our continent is quite diverse in terms of the disease, in terms of zoonotic disease burden. For example, we have some of the outbreaks in terms of viral hemorrhagic fevers in some regions. We have the flu outbreaks in other regions, as well as some other zoonotic disease outbreaks. So it's quite diverse. Similarly, in terms of those skills or the resource, the workforce, infrastructure, surveillance systems in place is quite diverse. So one of the things that we are championing is that all countries undergo a priority zoonotic disease workshop, whereby countries pulling in their human health sector, their veterinary or agriculture sectors, as well as environmental sectors, can look inward and define what the priority is for them so that it's more sustainable, it's less prescriptive, and countries can have some sort of ownership in terms of how they take control of controlling their disease outbreaks. What we currently have on the continent is only 17 countries have gone through that process of defining what their priority zoonotic diseases are, and one region, which is ECOWAS. What we did is pulling together all of the findings, and we were able to identify some 5 diseases that cuts across all 17 countries and ECOWAS region. Rabies, anthrax, brucellosis, viral hemorrhagic fevers, which of course cuts across the Marburgs, the Ebola, Lassa fever, as well as avian influenza. So those are the 5 sort of groups of diseases that has come out strongly on the continent. But we know very much that countries must define what their own sort of priority zoonotic diseases are. And as such, we have started to look at and explore ways we can support member states as well as regional economic communities. Over to you.
My apologies. May I please ask all of the panelists to please turn on your videos? Thank you.
Any other panelists that wanted to add to that question? So now I'm going to ask a difficult one about seeing Patrick ask the SDGs, the Sustainable Development Goals and the AU 2063 agenda have various targets and indicators that indirectly monitor aspects of One Health. How can we use this data to promote zoonotic disease research and surveillance in humans and animals that will create burden of disease data for humans or animals, improving our ability to detect emerging diseases and respond to outbreaks? Is there anybody, I don't know, Prof. Kabasa, I see your face now. I don't know if you want to try and link this to the SDGs, thinking about that question. Or anybody else from the panelists? Prof. Kabasa.
Yeah, yes, thank you. I had to get this. How do we use the data to address the SDGs and the Africa Agenda 63? The One Health approach provides an opportunity for aligning the pillars of the different professions, integrating this so that we are able to bring results and data that is transformative at the continental level. This is the unique opportunity that the One Health approach presents. It presents a common agenda from the health perspective, and therefore aligns and integrates the outputs and outcomes if systematized and harmonized. It provides a mechanism for fast tracking. And so the researchers, the universities, and other institutions in the various member countries, when sufficiently networked, they provide that opportunity. And we are looking at this as one of the efforts that the cross-border agencies, such as the AfroHone, the Africa One Health University Network, bringing efforts in Eastern, Central, Western, Southern. You create a web, you create an opportunity for a portal, harmonizing this data, harmonizing this information, collating it, and translating it into policies that apply not only at member countries or sub-regional level, but can translate to a continental level. We have the immense opportunity to do this. And this is a unique opportunity that the One Health approach brings in. But it will require that these bodies such as the Afrohun and others that have come up, get logged in at a command center, such as the Africa CDC, because you need the continent-wide leadership that is able to command, coordinate, integrate, and communicate. These mechanisms are required. And I think the emerging efforts at the Africa CDC, the regional bodies, the regional university networks, give us that opportunity and help us to accelerate the SDG agenda and the Africa Union Agenda 63. Thank you.
Thank you, Prof. Any other panelists that want to comment on that? Okay, so we almost are, sorry, yes, go ahead.
Yeah, so I just wanted to say that most importantly, looking at it from a policy perspective, is we have enough, despite being limited, to advocate for a lot of domestic financing. Many of my colleagues on the call will realize that and agree with me that all of these gaps or all of these challenges that we raise every now and then is because there hasn't been any political commitment. So I think as we continue to promote some of this research, improving surveillance, it's to use the data to drive policies, financing, as well as political commitment. The SDGs, the AU Agenda 2063 are starting points for us, but we need to get the high level political commitment for the continent. Our heads of state need to realize how important One Health is and how important it is to address issues of around zoonotic diseases, AMR, food safety, and as well as biosafety and biosecurity.
Thank you, Jamande, for those comments. Any more comments from the panelists? I think I'm going to stop the question. Sorry. Yes.
Ouais.
Fatimata?
C'est juste, oui, c'est juste à la suite des collègues dire que
after my colleagues, concerning the SDGs, these are really objectives in the Sustainable Development Goals. And at that level, promotion of One Health approach help not only countries at national level, but even at regional level, better coordinate their activities, programs, sub-regional programs, cross-border approach of the research. For us at our academic level, we have to make recommendations so as to meet the objectives, the SDGs, be it the objectives related to health, related to environment or health. We need to remove silos in countries. We need to have a health approach that goes beyond. It's a pooling of efforts and expertise that should help us really meet the challenge. At national level, there are many things that are being done, but they are quite scattered in a scattered way. We need to go together, we need to better coordinate so that you know what's happening in universities and share experience as the challenge of sustainable of health firstly and then the others. Thank you.
Thanks so much for that. Wayne, any final remarks from your side?
Yes, thank you. Very quickly, I wish to re-emphasize the importance of the international health regulations and the need for collaboration among the sectors and among the various stakeholders. So we all have a role to play, and I've seen in the chat that some colleagues were looking at how they can contribute. I think through the international health regulations and the process of work, I think every one of us has a role to play. Thank you.
Thank you, Wayne. So in the sake of time, I'm going to hand over to Prof. Lacan, who's going to introduce the speaker who's closing the session today. Thank you for all the comments and all the questions. There were some that we couldn't answer that we will answer directly after we will answer you directly on specific questions. Thank you.
Thank you. That's been so great. Thanks, Wanda and the panelists. Without wasting more time, I'm going to request Bill Cunningham to come on to provide us with some closing remarks. Bill is an Associate Dean for Global Health and the Director for Institute for Global Health at the College of Osteopathic Medicine in Michigan State University. Over to you, Bill.
Okay, thank you very much. And thanks to all the panelists for a very comprehensive approach here to One Health. You know, it strikes me in terms of Dr. Kanini and I, over 12 years ago, we were in a conference at University of Nagasaki preaching the One Health approach. And it really is an approach that needs to be thought out systematically and holistically in order for us to be successful. So today we listened to several of our panelists talk about the intentional approaches to One Health here. For example, Dr. Ramakrishna with his One Health Forum that was started in 2015, Dr. Alimi, that the One Health concept is a huge umbrella, and she started with through the CDC with these surveys, and that's so we have to start somewhere, and having those surveys also increases awareness of what certain people are doing, certain universities, certain countries are doing or not doing, and it helps to increase the proliferation of the One Health concept. Dr. Kabasa with his MEL monitoring, evaluation, and learning system was very insightful. And then with Dr. Diop and talking about, you know, what certain universities and the approaches for research, which is critical, very critical to highlight the potential impact on society and to influence policymakers. And I had a couple slides here, but in the interest of time, if you will just go to the one slide, please, that shows Michigan State University and all of our colleges. The next one, that one right there. Back up one, please. So when we look at all of our colleges and our institutes here at Michigan State University, we have tried to go out and indoctrinate them this holistic approach to One Health. But like I said, this has been occurring at Michigan State University for over a decade now, with gentlemen like Dr. Kanini and other people that profess the One Health discipline. And we need to make sure that we continue to have that happen. One way that we're doing it at Michigan State University, will you go to the Global Health Studies slide, please? Is that, next one, please, is that 3 years ago, we started a master in Global Health Studies, and that curriculum is based on the Consortium of Universities of Global Health, but it has the One Health thread through all of the courses that we teach in either the certificate program or the master's program. And that's very important that our students that will learn in every course what the approach to education, research, and capacity building is. And that's our One Health approach here in the Institute for Global Health. So again, I thank all of our panelists. I thank the University of Pretoria for putting this on. And I hope to hear more from all of you in the future. And please keep this One Health initiative going, because it's one of the approaches, probably the most important approach in my mind, to solving some of the most vexing problems in our world. Thank you very much.
Thank you very much. And I would like to now also thank the panelists and of course my co-moderator. I've seen some of the comments. You've done a wonderful job, and thank you. And thank you so much for accepting the invitation. It is clear from the comments and the questions that we were able to get people who really matter in the front lines, the voices of those who practice One Health, and they've been able to share their experiences. Again, this should be an ongoing dialogue. For now, just because we have 90 minutes, we have to stop. You're also welcome at any time to visit either the Center for Virus Diagnosis or reach out to the School of Public Health, School of Health Systems and Public Health at University of Pretoria on opportunities to be part of this conversation. So I'd like to say again, thank you and all the best. Take care.